for a whole variety of reasons. It's bad for the country. What do we do now? One of the big challenges and one of the great fears that I had, that once the Congress enacts a law like this, a massive entitlement, it's very hard to take it back. It's very hard. So what do we do? I mean, I think we're going to have to find ways to defund this, to defund it. That's probably the most effective thing we can try to do in the short term. You know, in the intermediate term, you know, we're going to have to try to repeal the major provisions. What I mean, we have to get rid of these mandates, the employer mandates, the individual mandates, the tax increases, the Medicare cuts. They didn't cut Medicare to save Medicare. They didn't try to fix it. They cut Medicare to create a new entitlement program. Can't do that. Can't do it. So what else are we going to do? Defund it, repeal where we can, as best we can, but let's be honest. In the short term, you know, between now and November, the people who just voted for that law aren't going to vote to repeal it. And should we get it through to the president, he won't sign a bill to repeal it. So what we have to do right now in order to stop this damage that they've just done is we need to elect a new Congress. And then we're going to need a new president. That's what we've got to do. And a couple other things. That's probably the best thing we can do. You know, during this health care debate, I went before the House Rules Committee. This is where they're going to try to deem and pass, you know, Congressman Slaughterhouse rule, all that sort of thing. I go up into the Rules Committee to offer amendments to the bill on medical liability reform and to strike the medical device tax. Alcee Hastings, presiding, from Florida, impeached judge, now a member of Congress. He basically didn't like my amendments, and basically 2 hours before I got in the colloquy with him, he said, we make up the rules here as we go along. We need to replace the people on that committee. We need to replace them. It was an outrage. And that's what we're fighting against right now in Washington, that kind of arrogance. And a Speaker of the House who can stand up and say, we need to pass this bill so that you can find out what's in it. Please. And you know what? And now we are finding out what's in it. We're finding out how retirees are at risk of losing their prescription drug benefits because of one change they made, the Medicare Part D. And now Henry Waxman is waxing indignant because people are reporting the losses they're going to incur. He's going to scold them next week. You know, if they don't report those losses, he'll send them to the SEC and say they're cooking the books. That's what we're dealing with in Washington. And so we're going to have to try to chip away at this thing as best we can between now and November. We've already started on some motions to try to take out some of these provisions as best we can, but you know, it's been a losing effort so far. But you know, we're going to keep fighting. Thank you.